Okay, sorry about that. This is Amendment .04H. It has been distributed. This will help the Department of Social Services try to get better rates with their pharmacy program, which is a high priority in the next year.
Okay, this is, yes. This is going to allow the Director of Mo Health Net to better manage the individuals that have the highest utilization for their multiple maintenance drug usage.
Several different plans have been discussed, and this is just moving in that direction.
And I do believe that the Senator Sater has been in agreement with this.
That's my understanding.
You're the House sponsor, Director of Mo Health Net, and the pharmacy people in the governor's office, and Representative Frederick. I think this was something that we had hoped we might be able to continue to talk about, but later on to make it better on the floor. Do you have that?
Right. I believe we discussed in committee, I believe what was in Social Services Committee where Dr. Park was there, and we were talking about narcotics. And I inquired of Representative Morris, and we established that the cost of narcotics can be very, very high every month, I mean, thousands of dollars. And we also discussed the recent recommendations from President Obama and from the AMA, and there are a number of medical groups that have made recommendations to drastically reduce the way in which narcotics are prescribed. And I thought that there was a really great opportunity for us to call out in this amendment the particular opportunity and to direct the attention of our director to benchmarks, or I don't know if you call it step therapy, but additional parameters taking into account the recommendations that have been made for very short duration of treatment with narcotics for pain. So, I mean, this seems like it's a little bit of a late coming idea. It's the first I've heard of it today, this particular amendment. So tell me a little bit more about how this would actually work and what would this do? How does it help?
Well, this is just putting into statute that we're expecting Mo Health Net to do the best they can with negotiation on drug pricing. And you were right, in the committee we talked about the prescriptions that are being written for opiates after surgery. You know, why are they 30 days instead of 2 days, and things like that for him to look into and for the department to look into. And this is just verifying that we have that expectation.
The question I have, or the concern I have, is that we're authorizing the Department of Social Services to use best clinical practices. When, I mean, there's only one guy who's really a doctor, and he's not actually providing the care. So you're going to have these mid-level bureaucrats using best clinical practices. I mean, maybe this is the right thing for us to do. We got an exploding budget for prescriptions, obviously, but I would have liked to have this vetted a little bit more than just like right here, right now, poof, off we go. You know, I don't know.
I interpret part of this too. We had disease management 3,700 a couple years ago, 3 years, 4 years maybe, that Department of Mental Health did, and this was through Mo Health Net, and there was a significant benefit, and that's looking at better medicine to identify better management of the heavy utilizers. And yes, we have, I mean, social services, of which the director of which Medicaid is directly under that. So I see it as Mo Health Net, physician run, controlled, by by Joe Parks, this was something that was believed would be a benefit to us at this point.
May very well be a good idea. I guess it's just because this is my first glance at it, so I'm a little reluctant to just throw all in with it. But it sounds like it may very well give our director more power to leverage costs down.
And we can continue to talk about this for when this comes up on the floor too.
Okay.
Representative?
I'm going to speak a little bit to this. I think our Medicaid spend in the pharmacy program for some of the folks that spend an inordinate amount of money on drugs, we can save dollar for every dollar we spend on preventative measures in the pharmacy program. We save multiple dollars on top of that. And I think the desire is to have those patients that are have so many medications, meeting with their physicians and their pharmacists to figure out how those are interacting poorly and get on a plan that is functionally works. Now there's data to show that these pharmacy programs reducing the cost of the amount of drugs that are being taken by patients are very effective, just like in preventative medicine with the docs. And I think because of our spend going out of control, what I understand, this amendment allows the department to provide some preventative measures that show they save significant dollars and this is not for every single patient across the spectrum. This is for those patients that are on significant amount of medications, the highest need folks, and there has to be, I believe it's a program that has to be significant savings for it to even function. So I think it's an important program. I think it, as far as the way I understand it, this just allows the department to focus on those patients that have significant amount of meds, and between the doctors and the pharmacists to reduce some of the costs of that by meeting with those patients on a regular basis and going through what meds they're on and making sure that it's not even costly to our healthcare system.
Yeah, this is not going to affect every circumstance. Representative Kirkton.
Personally, I don't have a problem with evidence-based medicine. My concern is a lot of these drugs, particularly like Hep C, are exorbitantly expensive. We don't have the ability to negotiate prices, and we already wait till people have cirrhosis of the liver before starting that. So my concern is that this not be something that we're just going to throw people off medications to save money, that it be done in an ethical manner.
I would definitely second that and assume that's the circumstance.
No, I think my general objection is that the intent and the value of it is, as Representative Fitzwater described, targeting in on high utilizers with multiple medications. But yet the language doesn't say anything about that. The language just says, notwithstanding, and I'm looking at the right one, right? Ends in 0.04H. Best clinical practices to achieve cost efficiency when administering mobile health net pharmacy program. So it doesn't drill down at all and say that we're going to do this for the group of people that we reference. So I think the concept is good, but the language is much more broad than that. And I was just reading an article, I think it was yesterday or day before in Wall Street Journal, about at a national level, we're empowering bureaucratic regulation by being vague in our legislation. And I think this may be an example of how we've got this in mind, but after we enact this, that whole targeted thing out the window, and do whatever they want with this language right here. So maybe it's a good thing, maybe it's a bad thing, but I think I would like to see us target what we really want to achieve with language that is more focused rather than broad.
And maybe we can continue this discussion and we'll have an opportunity to go where you're saying on the floor.
What this committee and the body thinks.
Okay, thank you. Okay, all those in favor of adopting House Committee Amendment number 2 signify by saying aye. Aye. Those opposed by saying no. The ayes have it, the motion carries. Okay. I have an amendment. It has been distributed. I move for its adoption. It is 0.03H. This is cleanup language. Megan can go through every bullet.
Okay, the amendment on page 1 of the bill, line 8, after the word address adds and, which that was for clarity. And on page 2, line 28, it removes the words on a yearly basis because in the previous part of the sentence, it says that it has to happen on each year and it was just duplicative language.
Questions, discussion, seeing none. All those in favor of adopting House Committee Amendment number 3 signify by saying aye. Aye. No. Opposed signify by saying no. And the ayes have it, the motion carries. I move we roll the adopted amendment into a substitute and adopt the substitute. All those in favor signify by saying aye. Aye. All those opposed signify by saying no, and the ayes have it, the motion carries. I move that House Committee Substitute for Senate Bill 607 be voted to pass. Secretary, please call the roll.
Chair Allen? Yes. Vice Chair Hafner? Aye. Representative Kirkton?
Yes.
Barr?
Aye.
Conway?
Aye.
Davis?
Aye.
Fitzwater?
Aye.
Franklin? Frederick?
Aye.
Meredith?
By your vote of 8 ayes, 1 no, you have voted House Committee Sub for Senate Bill 607 do pass. We will go on to HJR 98, Representative Moon. I move that House Joint Resolution 98 be voted do pass. Any discussion? Representative Moon, you want to just say one very brief comment? Do you have anything you'd like to say to us?
If there are any questions, I'd be glad to answer, but essentially this is just recognizing that life begins at point of fertilization or conception and recognizes they are persons. It will be an amendment to our Constitution, our Section 1.
Okay. Representative Kirkton. Proceed.
Good afternoon, Representative. The language still in there about rape and incest, is that removed or is that
It
still
has
in
been
there?
removed, yes,
Okay.
lines 13 and 14.
Okay, all right, thank you.
You're welcome.
Okay, and that was moved that we adopt House Committee Amendment number 1. That was what Representative Kirkton just mentioned.
Yes,
Is
ma'am.
that correct? Okay. Further discussion, seeing none. All those in favor of adopting House Committee Amendment number 1 signify by saying aye. Aye. All those opposed signify by saying no, and the ayes have it, the motion carries. I move that we roll the adopted amendment into a substitute and adopt the substitute. All those in favor signify by saying aye. Aye. Those opposed signify by saying no, and the ayes have it, the motion carries. Yes. I move that we do pass House Committee substitute for House Joint Resolution 98. Please call the roll.
Chair Allen?
Yes.
Vice Chair Hafner? Representative Kirkton? No. Barr?
Aye.
Conway?
Aye.
Davis?
Aye.
Fitzwater?
Aye.
Franklin? Frederick?
Aye.
Meredith? No.
By your vote of 7 ayes, 2 noes, you have voted House Committee substitute for House Joint Resolution 98 to pass. Thank you. Okay, we will go to House Bill 1953. Representative Swan, I move that House Bill 1953 be voted to pass. Any discussion? Or would you like to give us a brief?
Something came up the microphone. Madam Chair, I'd be glad to do so. This bill I filed 3 years in a row. It's sponsored the Planned Parenthood Clinic Ambulatory System Clinic Inspection Bill. It also this year has language on it that reinforces the reporting requirements. Be happy to answer your questions.
This was referred very early in session. Is this
Yes, it is. It was on the Senate calendar last year, and due to the slowdown of the Senate last couple weeks of session, it did not come up, obviously. I refiled the language again in December.
This was a priority for us.
Yes.
Okay. All right, further discussion, Representative Haefner.
I just want to verify, is this part of the bill that we passed last week on the floor also? Is this included in that other bill?
It was included. This
Okay.
was filed prior to those bills, but yes.
Thank you.
All right, so we've heard the content in other areas. Okay. Further discussion, seeing none, please call the roll.
Chair Allen?
Aye.
Vice Chair Haefner?
Aye.
Representative Kirkton?
No.
Barr?
Aye.
Conway?
No.
Davis?
Aye.
Fitzwater?
Aye.
Franklin? Frederick?
Aye.
Meredith?
No.
By your vote of 6 ayes, 3 noes, you have voted House Bill 1953 to pass. And we will go to House Bill 1608. Again, Representative Swan, I move that House Bill 1608 be voted to pass. Any discussion? And I move that we adopt House Committee Amendment number 1. And this came up through the Standing Committee. Representative Frederick, this came through your committee?
It did, and Representative Swan and I worked diligently together, and I think since she's right here, maybe we'll let her, unless you begin, and I'll add if need be.
I'd be glad to if that's municipal manager. Thank you. This bill I filed 2 years in a row. The drastic change that you see between the bill last year, the original bill this year, and the amendment that you see developed as a result of conversations, particularly between Representative Frederick and I. Yes. It does work, after all. It came to light that the 9 states have enforced, particularly Southwest states, have enforced a regulation of these fill mills. And rather than approaching it from a regulation standpoint, we decided to explore an enforcement standpoint. During that process, it was determined that the Bureau of Narcotics and Dangerous Drugs had 20,000 registrants to prescribe narcotics and 9 enforcement officers a number of years ago, but currently have about 30,000 registrants and 2 enforcement officers. So you may recall that we passed on the floor a fund for alcohol and tobacco fund, so the funds could be used for the enforcement of the alcohol and tobacco laws. And this amendment creates a similar fund for the Bureau of Narcotics and Dangerous Drugs. Currently, they collect about $800,000 of fees. The money goes into general revenue, and they are returned in the amount of $200,000 if they had a fund that's dedicated strictly for their work and the hiring of additional officers. This can certainly have a tremendous impact on enforcement.
Okay, and Representative Frederick, you have an amendment to the amendment?
I do, and it is to sort of correct a ratio, and I can't find it.
Has it been distributed and you move for its adoption?
It hasn't been distributed and haven't moved yet. I'm still trying to find it.
048.
There we are. Thank you very much. So I'm told that it has been distributed, and I now move for its adoption. And may I describe what it does? The initial language really sort of just took a stab at what the ratio was going to be and how many. The problem is they've got 2 enforcement officers, and they used to have at least 9. I think it might have been even more than that. And in that intervening time, the number of narcotic prescriptions and the number of registrants prescribing narcotics has gone up substantially, while the enforcement officers, so their capability of actually going out in the field and doing anything about these areas where a problem have gone down. And so this just allows them to keep the money, but it establishes a ratio to get them back up to proper number of enforcement officials. And I think this ratio results in 12 officials, 12 enforcement officials. That's the purpose of the amendment.
Did you have anything to add to that, Representative?
No, I do not.
All right, I was told that the department had some concerns about this, but I think they came very late to the party. So,
If I may, I also would add that perhaps a fiscal note on the previous approach, there would have been one. On this approach, we are simply taking the fees that are already generated and allowing them to keep those fees for this enforcement.
okay, further discussion, Lieutenant Hagener.
To Mark, please. And that was my question about a fiscal note associated with this plan. So will there be an additional cost at all to the Department of Health that's not actually been accounted for in budget that we're now working on?
I'm not certain, since we do not receive fiscal notes from amendments that leave standing committee, that remains to be determined, but we know $800,000 is collected from those fees, like nursing licensure fees, and those fees would then be in the fund for the use of BNDD. The original bill itself set up some additional regulation, which would require some computer changes and additional follow-up on part of the department, so that's why you see a fiscal note on that one. I expect it to be significantly different on.
What was the fiscal note?
It was, which no longer applies at all.
Okay, so it has no bearing on.
The fiscal note that you are looking at, or if you have, is the old bill language. It is not the amendments, because the amendment passed in the standing committee does not trigger the new fiscal note.
I guess what I'm wanting to know, is the department going to have more personnel to administer this fund, but you're saying that the fund itself will offset the costs?
So the fund would be used for administration, hiring purposes, educational purposes, for the enforcement of the Bureau of Narcotics and Dangerous Drugs Department.
Where does this money go right now?
General revenue.
Okay. So, okay, thank you.
Representative Kirkton, your question.
Comment. So the $800,000 in fees is, if it's going in the GR, I assume the department is using it somewhere. So I guess if this passes, it would have to go to fund these enforcement officers out of wherever they're using it in their department currently.
We're not certain where the $600,000 go.
Right.
We do know 200 comes back. It's like nursing fees. Nursing fees stay within, for the Board of Nursing, within Division of Professional Registration for the use. And as you recall, we had a bill a couple of years ago that took some of those fees, allowed them to be used for scholarship purposes for nursing students at various grants, various universities. $600,000, the BNDD department has no authority over, does not use it, is not able to use it. Creating a dedicated fund will ensure that they can.
Yeah. No, I understand your reasoning. I'm just saying if this passes, it'll come out of wherever they're using it now to go to this.
Correct.
Right.
I would just comment that this is kind of a hidden tax. If it's not used to actually administer the program and do the purposes of the BNDD, and the money is just being additional money, like 4 times as much as is needed, is being collected, and then it's being siphoned off into general revenue, that's not transparent at all. I mean, the examples we have of the other professions, that money is used to operate the department that's receiving the fees from the registrants. So either if all they need is $200,000, they ought to reduce their fees to the point that the fees sustain that, and not just siphon off money to go to the general fund. So, but if there is an additional need, and Representative Swan and I determined there was a sizable additional need that is not being met, well then, let's use the available resources that are being produced, particularly because of this registration for BNDD, and use it for those purposes.
So this is not a cash cow.
Right.
Further questions? Seeing none. All those in favor of adopting, House Committee Amendment number 1 to House Committee Amendment number 1 signify by saying aye.
Aye.
All those opposed say no. The ayes have it, the motion carries. All those in favor of adopting House Committee Amendment number 1 as amended signify by saying aye. Aye. Those opposed say no, and the motion carries. I move we roll the adopted amendment into a substitute and adopt the substitute. All those in favor signify by saying aye. Aye. Those opposed say no. The ayes have it, the motion carries. I move that House Committee sub for House Bill 1608 be voted to pass Secretary, please call the roll.
Chair Allen? Yes. Vice Chair Hefner? Representative Kirkland?
Yes.
Barr?
Aye.
Conway?
Aye.
Davis?
Aye.
Fitzwater?
Aye.
Franklin? Frederick?
Aye.
Meredith?
By a vote of 9 ayes, no noes, you have voted House Committee sub for House Bill 1608 do pass. We'll stand at ease for a moment.
Madam Chair.
Senator, I thank you for coming.
You bet. Yeah, may we go ahead?
Thank you, Hefty. Thank you, gentlemen. I did not see you. I move that Senate Bill 635 be voted do pass. Any discussion? Would you like to just briefly tell us?
Madam Chair, I'd be happy to just briefly describe the bill. The bill deals with the establishment of the Missouri Palliative Care and Quality of Life Interdisciplinary. There we go, it helps a little bit, we'll turn it on. Yeah, this establishes the Missouri Palliative Care and Quality of Life Interdisciplinary Advisory Council. It basically is to raise the awareness of what palliative care is, so that individuals throughout the state know what the services that are available to families in need when they're dealing with a serious illness or long-term diseases, and that's kind of what the palliative care. I like to talk about it. It's like a cousin to hospice type of care, and but for not terminally ill individuals, but for long-term serious illnesses. And so with that, I would have to field any questions, Madam Chair.
Okay, I have an amendment. It has been distributed and I move for its adoption. And we'll start with okay, we'll start with Amendment .04H. This is the physical therapy compact, which was presented to the Licensing and Professional Regs Committee. So this compact is like a driver's license. It's a group of states that work together. Your licensure in one then is going to carry over to another state. Any questions? Oh, Representative Frederick.
I just want to sort of repeat some concerns that I had. I think this came through professional red as well. And I think the devil's in the details. I worry a little bit that we are giving away our autonomy to regulate our professions by entering into these compacts. But having said that, going on the record of saying that, and acknowledging that our chair is not only of the profession, but is in favor of this, I will be voting with the chair. But I wanted to just go on record. I have a little bit of cold feet about this.
And I appreciate that. One thing I like about this is that if you have a professional license in any state and they have an ethical issue come against their license, that goes with them to these other states. Whereas without something like this, someone who's had a charge in one state, an ethics violation, could go to another state and has a clean slate. And to me, that is good transparency and accountability.
I have a question. And I don't know the answer to this, but you're familiar with the National Practitioner Data Bank. It is a repository at the federal level where if I lose my hospital privileges or I get sued or there's a whole bunch of triggers for physicians, I'm in that database. Does that go for physical therapists too?
I don't know. But nurses have this. Representative, did you have a question? Okay. Representative.
I just wanted to ask, did this bill pass out of that committee?
I believe it has.
And did anybody oppose it?
I think there were questions.
I mean, a public testimony against.
No, Who said that? Oh, yeah, I'm sorry. Representative Davis.
There was no opposition given in committee. Just like Representative Frederick had said, there were some questions about how the compact would be set up, who would be making the rules, etc. And my explanation was, we will be the first state that does it. We will be waiting for 10 other states to get on board, and it's at that time that they will be making the decisions.
Okay, thank you.
Further questions, seeing none. All those in favor of adopting House Committee Amendment number 1 signify by saying aye. Aye. Opposed, say no. And the ayes have it, the motion carries. We have another amendment, and it ends in .05H, has been distributed, and I move for its adoption. And this is an amendment that was put through, I think, insurance, but was not voted out of committee. And this is it's similar to the co-pay bill that we had a couple years ago for physical therapists, so that the co-pay rate was not significant, was not greater than the primary care payment for the doctor's visits. And the argument, the issue is that people often, because of their higher co-pays, would not attend all their rehab visits. And so they would skip those. Their outcomes are not going to be as good, and they would not really complete their plan of care. So this will allow for individuals to get the needed rehab services that they get. Questions, discussion, Representative Frederick.
I recall this from past years, haven't we passed this before?
We passed it for PT, physical therapy copays, but not for occupational therapy copays. I believe there was a bill last year, and I don't remember who filed it, but that was filed again this year.
And does it, and I don't have the amendment in front of me, it probably describes it, but does it make it sort of equivalent to the copay for physician visits?
It is, yes, it is. Okay, all those in favor of adopting House Committee Amendment number 2 signify by saying aye. Aye. All those opposed signify by saying no. The ayes have it, the motion carries. And I have a amendment, it's distributed, and I move for its adoption. It ends in .03H, and this is the cleanup. Yeah, Megan can do it.
Okay, on page 1, lines 7 through 17, it removes those. That definition is already an existing law in chapter 197.020. So when we can, instead of word for word restating it, we like to reference back. It replaces those lines and just says that hospital as defined in section 197.020. On page 2, line 5, after the word improve, it adds the word the, so the sentence reads better. Line 22, after the semicolon at the end of the sentence, it adds an and, which just connects all of the subdivisions. On page 3, it's just moving some commas so that the comma isn't behind facilities. It's on line 10. We remove the comma after facilities, and on line 11, we insert it after including. And page 4, line 36, after the word non-severable, it was just missing a comma.
Okay, we're very fortunate to have Megan as our watchdog. Discussion. Seeing none, all those in favor of adopting House Committee Amendment number 3 signify by saying aye. Aye. Those opposed signify by saying no. And the ayes have it, and the motion carries. I move we roll the adopted amendments into a substitute and adopt the substitute. All those in favor signify by saying aye. Aye. All those opposed signify by saying no. And the ayes have it, the motion carries. I move that House Committee Sub for Senate Bill 635 be voted to pass. Secretary, please call the roll.
Chair Allen. Vice Chair Haefner. Representative Kirkton. Yes. Barr.
Aye.
Conway.
Yes. Davis.
Yes.
Fitzwater.
Yes.
Franklin. Frederick.
Aye.
Meredith.
Aye.
By your vote of 9 ayes, no noes, you have voted House Committee Sub for Senate Bill 635 do pass. Thank you, gentlemen. We will go to House Bill 2582. Representative's not here, but because, I'm sorry, 2482. But we have a good chairman of Health, Mental Health, and so Representative Frederick will help us with those. So I move that House Bill 2482 be voted to pass. Any discussion? And I move that we adopt House Committee Amendment number 1. Proceed.
This was the bill that deals with the handling of medical records after an individual is deceased, and it establishes who has a right to it. I had some concerns, I think some others in the committee had some concerns about one particular area that has been addressed. But it was if an individual had a falling out with, say, a son or a daughter, and after the individual's demise, and the son or daughter discovered they were written out of the will, maybe they would want to make the fact that this individual had XYZ condition a, kind of retaliation. But there's language in the bill that allows the individual to prevent the release of his or her health records. And so I think those concerns are addressed, and the underlying bill, is a good idea to establish who has rights to those records after the individual is deceased.
Questions? Representative quickly.
Where, Dr. Representative Frederick? Inquire with Representative Frederick. What did you just say about the list of people?
It establishes, who has a right to the records, to the executor or the administrator of his or her estate, or the power of attorney for healthcare that specifically directs the healthcare records to be released to him or her after death.
Okay.
And then if no one was appointed, the deceased did not object, and this is key, did not object to the disclosure of his or her records in writing, the record should be released upon written request to the surviving spouse or personal representative.
Okay, well then it says, shall be released to the following persons, and it's got this whole list of people. Does that mean that everybody has to get it?
I think of those people that have the
Should it maybe
authority to ask for it.
Should it be may instead of shall?
And
If it looks like you have to give it to everybody.
if anybody who requests it, I don't think you have to just automatically distribute the records. It's if those people request it, then they have a right to have it. I think a good reason why, if the deceased has not said, I want my records closed, and one of those individuals, and go ahead and read them off if you want, ask for the records.
I'm just thinking there's a lot of people here who get a lot of records, and maybe they don't want them if it says shall. That was my
Well,
only
I don't
concern.
think it, I'd have to get the bill in front of me right now, but I don't think it causes them to have to furnish those. It's done in response to a request.
Okay, thank you. Further questions? Seeing none. All those in favor of adopting House Committee Amendment number 1 signify by saying aye. Aye. Those opposed signify by saying no, and the ayes have it. The motion carries. I move we roll the adopted amendment into a substitute and adopt the substitute. All those in favor signify by saying aye. Aye. Those opposed say no, and the ayes have it. The motion carries. I move that House Committee substitute for House Bill 2482 be voted to pass. Secretary, please call the roll.
Chair Allen? Aye. Mr. Hagner? Aye. Representative Kirkton? Yes. Barr?
Aye.
Conway?
Yeah.
Davis?
Yes.
Fitzwater?
Yes.
Franklin? Frederick?
Aye.
Meredith?
Yes.
By your vote of 9 ayes, no noes, you have voted House Committee substitute for House Bill 2482 do pass. Okay, and we have the last bill, House Bill 2518. Representative Frederick, are you good with that too?
Yes, that's also Representative Harr's bill and deals with stroke designation for hospitals. And his underlying bill allowed, he brought up in his presentation of the bill that the data collection and documentation for becoming a stroke center, there are other organizations that acknowledge the preparedness of a hospital to care for stroke victims, and that his bill allows the hospital who has already met the criteria for designation by the American Stroke Association guidelines, the American Heart Association, and the Joint Commission. And if you have met those criteria, then you shall also be granted status as a stroke providing center. And so that was the underlying bill. And then in committee, we amended it, trying to recall, yes.
Before you proceed, I neglected to move that House Bill 2518 be voted to pass. Thank you for the discussion.
And so one of the amendments that we put on in committee was that apparently the Board of Healing Arts, the Department of Health and Senior Services that administers the stroke program has promulgated rules that require additional CME. And traditionally, historically, for many decades, the Board of Healing Arts has been the entity that is charged with the responsibility of determining how many CME and what type of CME, continuing medical education, doctors need to maintain their license. And so the ER docs were concerned that if they needed this additional 10 hours of CME, it was going to crowd out all the other stuff that they have to stay good at to be able to, safely staff the emergency rooms. And so this established that it's the Board of Healing Arts that really establishes the criteria for how much and what type of CME you need, and not, because if we have other departments, dictating, pretty soon we'll have, everything crowded out from these special interests instead of the Board of Healing Arts that's looking at the big picture. And so that was voted out by committee.
And that was House Committee Amendment number 1. Further discussion? I move that we adopt House Committee Amendment number 1. No discussion. All those in favor of adopting House Committee Amendment number 1 signify by saying aye. Aye. Those opposed say no. The ayes have it. The motion carries. I move that we adopt House Committee Amendment number 2. And you have that House Committee number 2.
Is this the one that ends in 2008 page? So this is very, you'll all find this very interesting. It's this idea that another entity that ties the Board of Healing Arts could determine that you need this additional CME, to me, was another indication that sometimes those who are charged with executing the statutes that we put in place are very creative with it. And so it was apparent to me that the boundary of the Board of Healing Arts being responsible for this educational component versus other departments usurping that was not particularly clear to those who did this. And so this amendment establishes continuing bureaucratic education, or CBE, which if it were developed and implemented, these individuals would have to obtain 10 hours, which is the 10 hours that they thought the stroke doctors needed in the ER. So 10 hours of CBE to understand the proper role of government in terms of the executive, the judicial, and the legislative. And so this is probably an amendment that on the floor, I might be convinced to, withdraw. Maybe not, though. Well, I would welcome additional comment on this, because I think there is a role for implementation of laws, but it is not a robust sort of legislative role. It's an administrative role. So with that, I want to see what the committee thinks.
Representative Fitzwater.
There's going to be a record of this, right? That he's offered this amendment, and that's why I just want to make sure we're clear.
It's on the website.
Okay.
Questions? All those in favor of adopting House Committee Amendment number 2 signify by saying aye.
Aye.
Those opposed, say no. The ayes have it, the motion carries. So, and Representative Hafner, you have an amendment?
I have an amendment. It is a .05H and it has been distributed, and I move for its adoption.
Proceed.
Thank you, Madam Chair. This amendment is the perinatal network bill that we had. Since this bill deals with identifying capabilities of hospitals, this is a good place for this perinatal net council bill to go on to. I'd be happy to answer any questions.
Representative Frederick.
I just have one comment. It's just sort of for the record. I know this will pass out of committee. I may even vote for it, maybe not. But my concern is with the regionalization, that I think this may interrupt the natural referral patterns that are in place right now for hospitals that have a relationship with another hospital. But if the regionalization draws them out, sort of like gerrymandering, then it's going to interrupt those referrals. I don't really see the need for the regions, but the rest of the bill seems appropriate. So anyway, I won't go into it in depth, but that's my concern.
Duly noted. Further discussion? Seeing none, all those in favor of adopting House Committee Amendment number 3 signify by saying aye. Aye. Those opposed, say no. The ayes have it, the motion carries. All right, I have an amendment. It has been distributed and I move for its adoption. And it is in .06H, and this is cleanup.
Okay, on page 3, line 64, it refers to subsection 4 of this section, and it's in subsection 4, so we just said this subsection. And on page 4, line 94, it says access to the department facility specified data, and we added access to the department to facility specified data to clarify. That's it.
Further, any discussion? Questions? Seeing none. All those in favor of adopting House Committee Amendment number 4 signify by saying aye. Aye. Those opposed say no. The ayes have it, the motion carries. I move we roll the adopted amendments into a substitute. Oops, I'm sorry. Proceed. You have an amendment and it's been distributed. And I rescind my motion I just started.
Madam Chair.
Proceed.
So this is sort of in response to the underlying stroke STEMI issue, and that is a requirement for certification as a stroke hospital, that the hospital helipad have a fence around it. And the emergency room doctors brought this to my attention, and the helicopter pilots brought it to their attention, in that these fences can be a hazard in terms of getting one of the skids hung up in the fence, or having in a gust, the rotors come down a little bit and clip the top of the fence. This is it's a safety issue. And so this bill this amendment addresses that issue, and just says that hospitals shall ensure that helipads are free of obstruction and safe for use by a helicopter while on the ground during approach and takeoff. And so this, again, was brought to me by the ER docs.
Representative Davis.
Just to inquire.
Proceed.
They got ground crew there anyway, don't they, make sure there's nobody on this helicopter pad.
I don't know if they necessarily have a ground crew as you would see in an airport, but the people transporting the patient to the helicopter would be, I mean, I've been around this for years, and when there's a copter taking off or coming down, the area is clear. I mean, this idea of a fence is just a hazard. And a lot of these, there's not acres and acres to like move the fence 100 yards away. It's going to be in pretty close proximity. And so
Somebody who was on an aircraft carrier with helicopters and planes landing, we understand that you don't have anything around the helicopter, so I think it's a good idea.
Representative Barr.
Barr,
Proceed.
do we need to amend the amendment to include CBE or fence building as well?
I would entertain that as a friendly.
Okay, I'll think about that for the floor.
Yeah, for then. Representative Meredith.
Did you say it's in conflict with a federal regulation of some kind?
No.
I thought you said there was some regulation that requires fences, and yet they don't think.
Because the regulation requires it, but it's a dumb regulation.
Oh, yeah.
Whose regulation is it?
The Department of Health and Senior Services that are promulgating these stroke STEMI rules to be a stroke STEMI certified hospital.
So it's the same place, it's not,
It's state, not federal.
okay,
The state is doing it, and we're saying not such a good idea.
okay.
Yeah, I'm sure they were well intending. I think this comes under the category of unintended consequences. They don't want helicopters to crash. They don't want the skids to get stuck in the fence. They just didn't think about it.
Okay, further discussion or consent?
They won't crash. It's working. To inquire,
Proceed.
and I'm just looking at the helipad at our healthcare facility, and it's about 50 yards from the main street. I mean, I've seen people run into a helicopter blade. I think we need to at least use a little discretion on where the pad is located. My comment. Thank you. Thank you, Madam Chair.
Okay, further discussion, seeing none. All those in favor of adopting House Committee Amendment number 5 signify by saying aye. Aye. Opposed, say no.
No.
And the ayes have it, the motion carries. I move we roll the adopted amendments into a substitute and adopt the substitute. All those in favor signify by saying aye. All those opposed say no. The ayes have it, the motion carries. I move that House Committee sub for House Bill 2518 be voted to pass. Secretary, please call the roll.
Chair Allen,
Yes.
Vice Chair Hübner, Representative Perkins, no. Barr,
Aye.
Conway,
No.
Davis,
Aye.
Fitzwater, Franklin, Frederick, Meredith,
No.
By your vote of 6 ayes, 3 noes, you have voted House Committee sub for House Bill 2518 to pass. We have covered all of the bills currently referred to this committee, I believe. We have one more slot. So Senate bills do not need slots. So we're holding that a slot open. And we are adjourned.